Good morning. Welcome to Salina Regional's Morning Medical. Today's program, I have with me Dr. Rebecca Martin. Dr. Martin is a new addition to Salina Pediatric Care. Thank you for being on the show. We're going to be talking flu shots. However, before we do that, I mentioned you're new. Could you tell us a little bit about yourself?
Yeah, so I grew up in Kansas and I graduated from McPherson High School, so it's been nice to come close to home to start my practice.
Okay.
So.
Why pediatrics?
I love children. It's fun to work with kids of all ages from newborns to adolescents. And I knew I wanted to do something in medicine from an early age, but children were what really drew me during medical school.
Well, an interesting thing happened while we actually came to your office to talk, and you left a patient's room and your nurse immediately went in, and I hear from inside the room, "Who are you?" to the nurse. Kids pretty much tell it like it is, but communication with kids has to be a little bit different though, correct?
It is. It's really fun because kids are very honest. They don't hide what they're feeling necessarily. They're not gonna pretend to have a symptom. So that's really nice. If they're under 4, I know they're really not faking it when their stomach hurts. The older they get, the easier it is for other things to convince them that they do or don't have pain. So in elementary school and middle school and high school, but that's what makes the communication part of it fun. You get to ask them things and find out more.
Okay. We mentioned we were going to be talking about flu shots. Yes. So what do the viewers need to know about the flu in general and flu shots?
So, well, first of all, the flu is a miserable thing. It starts off like a regular cold, but it can last for up to 2 weeks, and you can get lots of body aches and fevers, and you can be out of school, out of work for up to 2 weeks, and that would be a normal course for the flu. So not only does it lay you kind of flat on your back, it also sets you up to have other secondary infections, so things like pneumonias or ear infections for children or sinus infections. And if the younger you are and the older you are, the higher risk you are for having more complications.
One thing that came up recently with me was found out that actually pregnant women need to have the flu
They
vaccine
can, and
as
they
well.
should.
Okay.
Those, their immune response, they develop antibodies to the actual flu vaccine, and that crosses the placenta and helps protect the baby as well. So that baby gets some of that protection from that flu shot, which will help them until they're old enough to get a flu shot of their own.
So the takeaway regarding the flu shot is everybody needs to get it?
Everybody over 6 months should get it, and the people that are going to be around 6-month-old babies or younger should also get it to help protect them as well.
Thank you so much for being on the show. Thank you for watching. For more information, please visit SalinaPediatricCare.com and like Salina Regional Health Center on Facebook and follow us on Twitter.